Hey, Future Medics, Tina here, your medic mentor, and today we're going over another RSI medication, Rocuronium bromide, also known by the brand name Zemaron. If you need a longer lasting paralytic than succinylcholine, this is your go-to. Rocuronium is a non-depolarizing neuromuscular blocker. So instead of causing that initial muscle contraction like succinylcholine did, it blocks the acetylcholine receptors so no muscle contraction can happen at all, which does result in full paralysis of all of the muscles of the patient. The standard dose is zero point 0.6 to 1.2 mg/kg IV or IO. The onset is 1 to 2 minutes, but the duration is 30 to 60 minutes. Huge difference than what we saw with succinylcholine. So this is great for keeping a patient paralyzed after you've already gotten your tube. But remember, this is only a paralytic. It does nothing with your patient's level of consciousness or for pain. So we always give a sedative like etomidate or Versed, maybe even ketamine first, and then we give our paralytic. But also keep in mind, 30 to 60 minutes is a very long time. And sedatives usually work about 10 to 15 minutes. So we're going to need to keep re-sedating this patient because otherwise you'll have a patient who is awake and alert but unable to move, and that is the stuff of nightmares. Side effects include hypotension, tachycardia, and, of course, respiratory paralysis. But we planned on that, so make sure you're ready to manage their airway immediately. Now, contraindications look much better than it did with succinylcholine. It's going to be contraindicated in liver failure patients because ROC is metabolized in the liver, and patients with neuromuscular diseases. Now, here's your takeaway. Rocuronium is a smoother, longer-lasting option for RSI, especially when succinylcholine isn't safe. It's predictable and reliable. And as long as you've got your sedation in place and your airway skills are locked in, you're ready to go. But that's another medication knocked out. You're doing so great in this series. I'll see you for the next one.